Unless you've been living in a cave somewhere, you could not have missed the fact that we're living through an obesity epidemic. In fact, it's a pandemic. And while we talk all the time about what you put on with obesity, the weight and fat that you put on, there's something that research is suggesting you lose. Research at the University of California is suggesting that people who are obese and even just a little bit overweight are losing brain tissue at quite an alarming rate.
So obesity is a very hot topic these days, and whether it's something that can be prevented. One thing we found was that people who are overweight have a great deal of brain tissue loss as they get older. And this is a peculiar notion. And so when we were looking at the brain scans of elderly folks, the people that were overweight, not necessarily obese, just a little heavier than normal, had much less brain tissue. And this was one of the strongest predictors of how much brain tissue there was at a certain age.
It's all very well saying brain tissue, but in fact there are several kinds of brain tissue. There's grey matter, those are the nerve cells themselves. There's white matter, those are the cables that connect the nerve cells. And there are supporting cells. So what kind of brain tissue were overweight people losing?
It's really just the overall volume of tissue. So there's some critical areas.
So you've just got a knackered brain.
You've got a knackered brain, there you go. And these folks looked about 8 to 16 years older than their counterparts if they were overweight. And
so their brains look 16 to 18 years old?
Yeah, their brains look much older. And this is kind of a recurring theme in current research. A lot of us think, well, if we're going to get Alzheimer's or a brain degenerative disease later in life, there's nothing we can do about it. And it gives you a sort of happy-go-lucky attitude to health. What's increasingly apparent is that your vascular health, the health of your blood vessels in the brain, is something that's very controllable. I mean, you can basically exercise or have a better diet or do a number of things that keep your blood vessels healthy. And this seems to be the reason why there's a connection between obesity and brain health. It looks like the people that are heavier often have very high lipids, very high fat in the diet, and as a result it clogs the arteries, reduces the oxygen supply.
And the startling finding was that the amount of weight you carry is one of the strongest predictors of how much brain tissue you're left with at a given age.
So there's a lot of studies about caloric intake, and
which ages you faster.
It does. And one of the most controversial studies in recent years has been one that shows that if you restrict your caloric intake, a lot of folks live a lot longer. I mean, it's not a perfect correlation, but if you look at these very old people that live forever, one of the typical features that they have is they don't have a very high calorie diet. Now, I mean, that could either just be that there's things in their diet that are damaging their blood vessels, or there could be something to it that maybe you need less calories than you eat.
And have there been any intervention studies which suggest if you lose weight, the brain tissue regenerates?
Well, that's an interesting one. The studies have mainly been of exercise rather than change of diet. And it's very, very difficult to disentangle what it is in your diet that's affecting your brain. And so there's been studies of folate and vitamin B and all sorts of supplements that you could take that could affect the brain. They're very, very difficult studies to do. And so normally the interventions have been something that tackles your blood flow directly, taking up a fitness program, or it needn't be extremely strenuous, maybe walking a few extra blocks. And they've generally been very positive. And so people who've done studies of extra exercise or more activity in general, they've generally found that this does stave off brain loss as you age.
And you've studied that in brain imaging?
We have. So we looked at brain scans of super exercisers. And so these were people who are in old age very, very active. They might walk 5 or 6 miles a day. And their brains were just much more intact than their counterparts. And so we asked the question, what is it that they were doing that mattered? I mean, do you have to do something strenuous?
But they may have had intact brains which allowed them to exercise rather than exercise giving them
we control
intact.
for that. That's a very good point. Now, you can't just look at a whole lot of people and say, well, the people with unhealthy brains, So we ruled out all of the people that were not physically able to walk or to be active. And when we looked at the people that could basically get up off their feet and, wander around and that sort of thing, both the type and the amount of exercise mattered. So it seemed like on the first level, anyone who was just walking around and keeping active, in the 60s, 70s, and 80s, tended to look much better in terms of brain integrity, blood flow. And this is kind of common sense. I mean, it would make sense that we did that. We then looked at how strenuous does the exercise have to be. And anyone who can get their heart rate up or can sweat a little bit or keep the blood flowing a little bit better, they seem to have an extra benefit to their brain over and above the sheer effect of basically pumping calories and that kind of thing.
Where to next with this kind of research? Because it's all very well looking at a scan, but you've got to look at the whole person as well.
You do. And a lot of these interventions are being paired up with standard clinical trials. And so, a lot of the drug companies are curious, is a medication beneficial for the brain as it ages? I mean, we have a lot of new leads. None of them is a panacea. Some of them are moderately helpful. But there's a lot of questions. People say, well, do supplements help me? Do they help me a lot? Is it worth the money? Is it that they only help if I do other sensible things? And so I think we're seeing a bit of a sea change towards healthy diet, some exercise, and maybe some medication all being tested together.
And don't ignore the early years.
And don't ignore the early years.